Hi everyone, this is Lady T, and this is in my own thoughts, my thoughts of the day. Early this week, I started a series of videos talking about the effects of childhood trauma. Well, this is part 5, and I decided to do a slideshow presentation so that I can kind of compile all the information, and you will be able to look and see what the effects are, what to look like, what the signs are, and what exactly is childhood trauma and what is, in particular, post traumatic stress disorder. So, this is Childhood Trauma Part 5 by Lady T, and this is a post traumatic stress disorder. And a lot of the information I got from the Kelty Mental Health Institute. So, PTSD is a diagnosed after a person experiences symptoms for at least 1 month following a traumatic event. The disorder is characterized by three main types of symptoms: avoidance of places, people, and activities that are reminders of the trauma and emotional numbness. So, according to the DSM 5, which is the diagnostic tool used for clinicians, uh, PTSD diagnostic criteria for PTSD include a history of exposure to a traumatic event that meets specific stipulations and symptoms from each of four symptom clusters: intrusion, avoidance, negative alterations in cognitions and mood, and alterations in arousal and reactivity. And this is according to Anxiety and Depression Association of America. So some symptoms of PTSD are irritable, angry, or aggressive behavior, including extreme temper tantrum, hypervigilance, exaggerated startle response, problems with concentration, difficulty falling or staying asleep, or restless sleep. What is post traumatic stress disorder in young children? It is a trauma and stress disorder that a child or youth may develop after experiencing or witnessing a threatening event called a trauma. This event could have led to a serious injury or death, and they may have felt overwhelming fear, helplessness, or horror. So, here are some examples of traumatic events, and these are just some: domestic or family violence, dating violence, community violence, such as shooting, mugging, burglary, assault, or bullying, sexual or physical abuse, natural disaster, such as a hurricane, flood, fire, or earthquake, a serious injury, burns, or a dog attack, major surgery, or a life threatening illness such as childhood cancer, war or political violence, civil war, terrorism, refugee. How do I know if a child has PTSD? If the symptoms started after the child or youth experienced or witnessed a traumatic event, and if the symptoms don't go away, they might have PTSD. The symptoms can start right after the trauma or months or even years after. So, signs and symptoms are: there are four different types of post traumatic stress reactions. To be diagnosed with PTSD, the child or youth should have at least one symptom from each of these three types. So, number one, The child or youth may relive the trauma in their minds. They may. An example would be having upsetting and disturbing memories, pictures, and thoughts stuck in their minds about what happened. Act out parts of the event during play. Have frightening dreams. Act out the traumatic event or feel like it's happening right now. Be very upset or have physical reactions when seeing or hearing reminders of the trauma. Could be a siren, photo of the family member, door slamming, or bedroom. How do I know the youth has? And here's the signs continued. Number two, the child or youth may avoid things that remind them of the trauma. They may, for example, stay away from things associated with the trauma, clothing, dogs, if the trauma was a dog attack. Avoid thoughts, feelings, or conversations associated with the trauma. Number three, the child or youth may experience changes in thoughts and feelings as a result of the trauma. They may, example, forget parts of the trauma or be confused about when things happened. Think more negatively about themselves, others, and the world. Blame themselves or others for the event. Feel negative emotions such as anger, fear, horror, etc. Lose interest in things they used to enjoy. Quit sports team or dance class. No longer want to swim or play with friends. Not be able to feel positive emotions such as pleasure, satisfaction, etc. Four, the child or youth may seem extremely alert and, quote, on guard. They may, example, have difficulty falling to sleep or staying asleep, have a hard time concentrating or completing tasks, often be on guard or look for signs of danger, feel jittery or nervous, or easily startled, jump at sounds or possible threats such as telephone ringing or a dog barking. Do things that are reckless and dangerous, and they can also become angry easily. So, PTSD in different age groups, it's important to know this. Each age group has a cluster of symptoms, and some are similar and they do vary. So, early childhood examples are fear of strangers, family, or situations. They can be clingy, avoiding, or crying. Replays the trauma through play or artwork. And that's where you could see kids making dangerous kind of art, coloring different scenes, like really graphic scenes that are playing out in their thinking. More alert, easily startled, very aware of danger. Act younger or no longer use already learned skills. Stop using the potty and start sucking their thumb. Body complaints could be stomach aches, headaches, aches, and pains. Frightening dreams unrelated to the traumatic event. School age children could be afraid of being separated from caregivers, doesn't want to be apart, trouble sleeping alone. Loss of trust, doesn't trust caregivers to keep them safe. Negative view of the world, thinks the world is dangerous. Replays trauma through play or artwork, difficulty concentrating, loss of appetite. Does more things without thinking first, impulsive, fights without considering the consequences. Deviant or has intent, defiant or has intense anger, outbursts, or aggression. Mood changes, be unhappy or depressed. Loss of interest in activities they used to enjoy. Body complaints, stomach aches, headaches, aches, and pains. And as I said, some of the symptoms differ and some of them are similar. Teenage and young adults could be afraid to be separated from caregiver, clingy, resists being alone, tries to be near. Loss of trust, mistrust caregiver. Negative view of the world, thinks the world is dangerous. Impulsive behavior, substance abuse, self harm. Repeated thoughts of death, dying, killing themselves. Risky behavior, self injury, cutting themselves, alcohol and drug use, and also unprotected sexual behavior. Mood changes, seem unhappy or depressed. Loss of appetite, loss of interest in activities they used to enjoy. Body complaints, stomach aches, headaches, aches, and pains. What can be done? The first step is to make sure the child or youth is safe and their basic needs are being met. After that, if they keep experiencing stress symptoms for a month or more after the trauma, it is important to seek professional help. Cognitive behavior therapy has been very effective with helping children with trauma. CBT is the most effective treatment for post traumatic stress disorder. It teaches children and their caregivers about trauma and ways to cope with and manage anxiety. The child or youth learns to gently face fears instead of avoiding them. They learn to identify and challenge or boss back their unhelpful beliefs, such as the world is a totally unsafe place or it's all my fault. In CBT, they may be asked to talk about the trauma while practicing how to relax. They retell the story to work through the event and soften the power of the memory and feelings about it. Also, in working on brave behavior, the child or youth practices many types of situations with their therapist. They will follow up at home with bravery goals. And a bravery goal could be retelling the story of the trauma or sleeping alone. If the trauma was a car accident, they might have a goal riding in a car again. They might imagine riding in the car and then touch the car. Later, they might sit in the parked car and then ride it in it or in an empty seat, empty street, etc. They learn to take baby steps and pay attention to their stress levels as they go along. There are also medications that can be used. Medications such as antidepressant and anti-anxiety medications can help some children deal with symptoms of depression, anxiety, anger, sleep levels as they go along. Parents and other caregivers play a very important role in helping children with PTSD. Parents can help their children learn about anxiety and practice ways to relax. They can also help their child challenge unhelpful thinking by using helpful coping thoughts and apply learning how to engage in brave behaviors. Other tips to try at home could be have a calm, structured home environment, practice ways to relax, develop and keep the same routines morning, school, homework, bedtime. Provide clear expectations, limits, and consequences. Help your child learn about and identify feelings. Pay attention to your child's feelings. Remain calm when your child is anxious. Have realistic expectations for your child's age. Plan for transitions, getting to school, visiting relatives. Help your child focus on the here and now. Ask child to describe what they hear, see, smell, etc. Show your child the way you identify and accept your feelings. Show how to solve problems. Take care of your own needs. Talk to others for support and ask for help when you need it. Be aware of and manage your own reactions. Get help if you are struggling with this. Praise and reward your child's efforts to cope with trauma and stress. Powerful ways to reinforce your behavior, uh, the behavior that you're wanting them to have. Research has shown that healthy living is very important for managing PTSD and in promoting wellness. Healthy living includes regular exercise, relaxation, a balanced diet, healthy relationships, stress management, good sleep, community development, and social support. Where do you go from here? So now that you have all of the information you need, here are some resources. Talk to your doctor and look for help from a mental health professional by self referring or getting a referral to the local child and youth mental health team. Contacting your employee assistance plan if you have this option. Contacting a private psychologist or counselor, and also visit the BC Psychological Association website, or there's a toll-free number you can call. And then you can also visit the BC Association of Clinical Counselors website, or again, you can call. So hopefully these are really good tips that you can. And if you need more information, again, if the slides have not provided what you need, you can get that additional resources by contacting the resources I left here on the videos. So again, this is Lady T, and this is in my own words, my thought of the day. And this is the series, The Effects of Childhood Trauma. And I wanted to give you some information that will be helpful for you if you, again, are around or involved with a child that you now can recognize has some sort of traumatic experience happen to them. And as a result, you see these behaviors that were expressed in this particular video. Again, childhood trauma can be a lifelong issue if it does not get taken care of early on. And I've given you the different age groups and the different symptoms and signs to look for. Hopefully, again, you will be able to help assist in helping that child become more healthy and more productive as they grow into adulthood. This is Lady T. This is, in my own words, my thoughts of the day. And as I often say, make your day great, live your life on purpose, take care of everyone. I will continue. Again, I wanted to add some supports for family members, how you can work with children who have trauma, because it is very, very frustrating when you have someone or a child that you see going through this type of distress, and you will be affected by it. So I'll give you some support for the people who are working with children with childhood trauma. Take care. I'll talk to you all soon.